Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Drea and Brit. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Brit and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Becca Rose, who is the owner of Myofunctional Pathways based out of the Sheboygan area. Becca was a dental hygienist for over 20 years, and during her time in that career, she was introduced to a concept called myofunctional therapy. When her son was 3, she began to notice mouth breathing, a setback lower jaw position, and that he was sick a lot, which motivated her to learn more about how to help him and what myofunctional therapy really was. Through the learning process, she actually discovered that her own airway dysfunctions were the reason why at age 28, she had been diagnosed with sleep apnea and prescribed a CPAP machine. Becca became more and more passionate about this newly discovered missing link within her own family's health journey, so she decided to pursue sleep coaching, functional breathing, and myofunctional certifications, and to ultimately help others through this career. It's obvious that Becca practices what she preaches because as of 6 months ago, she no longer needed the CPAP machine she had been using for 14 years. Outside of work, Becca's hobbies include family activities with her husband and 7-year-old son, and expanding her podcast. And if you guys want to check it out, it's called Myo 360, Holistic Solutions for Better Sleep and Better Breathing. If you've never heard of airway or oral dysfunction or myofunctional therapy, you're not alone, but I will tell you that these episodes could literally change your life. You'll hear us, Drea and I, talking about personal experiences within all 4 episodes as well, because our kids and my husband have benefited from myofunctional therapy in the past. And I can't forget to mention that Becca is offering a special discount for our listeners. You can receive $50 off your myofunctional evaluation by mentioning the Motherhood Alliance podcast. In our 4 episodes together, we cover a plethora of areas that myofunctional therapy can help, including mouth breathing, teeth grinding, poor sleep quality, sleep apnea, bedwetting, ear infections, crooked or crowded teeth, TMJ pain, and more. So turn up your volume and let's get started with today's conversation.
Hey guys, welcome back to the show. We're super excited to wrap up this episode or these episodes with Becca Rose. Again, welcome, Becca. We're so excited you're here. We have talked through so many different things about myofunctional therapy and the benefits and all the things that it can help with, bedwetting, ear infections, crooked teeth, TMJ problems, sleep apnea, all those things. But one of the things that you've been talking about is, and one of the things that you really help people with is gaining habits, right? And we kind of touched on this in the last episode, and you had mentioned I could really do this swallow test with you guys, and we're like, oh, let's do that. So that's what we're going to start with here, but kind of open up the question of why is habitual swallowing so important?
Oh, we could talk a long time, but the habitual swallow is what maintains all the muscle function that you gain during myofunctional therapy. There's some programs that just give you exercises to work on strength. There's products and tools that can give you strength of the tongue and the muscles. But if you don't create that new habit and the muscles don't function the way they're supposed to, you're likely going to lose some of the benefits you gained from myofunctional therapy.
It's just like, if you're in the gym working out, right? If you're not going to work on the muscles of your body, it's the same thing in your mouth, right? You're going to become weak.
Right. And yes, so when we get to the end of myofunctional therapy and you've habituated or created a new swallow pattern, you essentially then continue to do myofunctional therapy for the rest of your life because you've made new neurological connections to your muscles. You don't need to think about it. It happens automatically. and you swallow 3,000 or 4,000 times a day and night. So think about that as that builds up and stacks up throughout your lifetime. As you get older, you keep all your airway muscles strong. You keep your tongue strong, your soft palate. That's a huge part of this we haven't talked about. But all those muscles need to coordinate together in a functional way in order to keep the benefits. If you don't gain that functional swallow, you're likely going to get your symptoms back and you're going to lose progress.
So makes sense. So much.
So how are people typically swallowing and how should they be swallowing? Like, what's the difference?
All right. So most of the time people are swallowing, well, we have a lot of open mouth chewing, right? There's a lack of coordination. Even if the mouth is closed and there's coordinated chewing, the swallowing part is dysfunctional. A lot of it has to do with where's your tongue in your mouth when you swallow. And yes, there is a place in your mouth where your tongue should be. And what are your teeth doing in that split second that you swallow? So we could take this now and then go into the swallow test because that's going to put the tongue in the right spot and put the teeth in a certain position. And what you're doing is you're keeping your jaw still, so your tongue has to do the whole swallow pattern by itself. They call it a peristaltic movement or peristaltic wave motion. That's the motion that the tongue should make when we swallow. That's the anatomically correct. Yes. So that's what we're trying to teach over time and repetition and practice. And that's when that neuromuscular piece comes in where you habituate it.
Okay. Well, let's do it because I'm really curious. I'm really curious if I'm doing it right.
It's simple to describe, but it's difficult to do. And this is also going to show me if you have what's called a tongue thrust or an anterior tongue swallow. And if that is seen, then that could be a big reason too why maybe braces aren't successful or we get open spaces between our teeth.
I had braces. They better have been successful here.
Okay, so here's what we're going to do. You're going to take a tiny sip of water, tiny sip. You're going to use your tongue and trap it up against the roof of the mouth. So think about like you're going to click your tongue, but you stick your tongue up to the roof of your mouth. Yep. So you're going to do that, but you're going to hold a little bit of water in your tongue. And then you're going to bite your teeth together, smile, and swallow. Oh.
No, I felt my tongue. I felt the tip of my tongue. I had it. I was with you. But when I swallowed, the tip of my tongue left the roof of my mouth.
Yep. I saw your tongue push forward a little bit too, all the way across the table here.
So it should stay in its spot?
Yes, it should.
So I should be able to swallow that without... Okay, walk us through that one more time.
So
you put your tongue, you put the little water on top.
Yep. Suction it up.
Suction up, okay.
Bite your teeth together. Smile big.
Okay. I think I did it.
Okay, do it again.
Oh, the pressure.
I know. I'll usually ask you to do this 4 or 5 or 6 times because I'm looking for consistency. Because it does sometimes take once or twice to figure out the coordination.
You're trying to look back and forth between both of us right now.
That too.
I hope you guys are all trying this at home. And if you're not, and you're driving or something, and you don't have water, you're going to have to come back and try it.
This is fun because sometimes we'll do this swallow test if I'm talking to a group of people in a room and there's like 20 or 30 people and we'll do a swallow test. And what we're looking for again is part of the tongue trying to squeeze through the teeth. Are you losing water? Can you not do this with your lips staying open?
Yeah.
Is it gulpy? Do you feel like you're going to choke or cough?
Yeah.
Does it feel stressful? And these are all things that can tell us, okay, the swallow is not ideal.
I feel like I was close. I feel like my water was leaking a little bit, but then it's also like, how much water do I have up there? I
feel like the first one surprised me. And then I felt like I did better after I was able to practice a couple times. But I know in prior episodes, we talked about proper tongue placement and where your tongue should be. Can you just review that with us really quick on where your tongue should be when you're resting? Like if you're standing in line at the grocery store, how should your mouth placement be?
Yeah, if you're not talking or eating, lips are closed, tongue is up on the roof of the mouth, teeth are separated just a couple millimeters so they're not in contact.
I feel like I'm pretty good with that.
Mm-hmm. Yeah, I felt confident with that one, which is why when you said swallow test, I'm like, oh, I don't know if I can do this. But another thing that you mentioned was the soft palate. Can you go into that a little bit?
Yeah, so we don't often think about our soft palate where the uvula is or the hanging ball in the back of the throat, right?
Yeah.
That's attached to the soft palate. that is a completely muscular structure. And if you do certain movements and we say different sounds, you'll see that soft palate contract up and lift. And when we talked in, I think it was the first episode, about some of the different tongue ties and how that posterior or mid-tongue restriction prevents the back of the tongue from being able to lift. If the back of your tongue and your soft palate can't connect with each other and they can't have a functional swallow pattern together, it's going to be hard to maintain the breathing, the chewing, the swallowing, and the sleeping, the snoring, the sleep apnea. Those structures needed to work together. And when we talked about ear infections and the swallowing with the ear infections as well, those muscles in the palate are not contracting and contacting with the tongue, which is why sometimes that eustachian tube can't drain, especially in kids, because they're not doing a correct swallow. So the swallow is the end goal. That is the end goal. If we can't habituate a swallow, I mean, so far it's never happened, but it could.
So we just did this little swallow test, which was fun, with a little tiny bit of water. And like I said, I think the more that you kind of practice it, the more you'll be like, okay, maybe I can do this, or maybe I'm identifying a challenge. But like in everyday life, when we're chewing our food and we're eating a meal, obviously you're going to have more food than just a little droplet of water. How should the tongue be pushing that food into the back of the throat? Then what does the function look like?
I can't answer that right now because there's so many steps to get there. It's not just as simple as do this and you'll be good. If it was, there would be no need for this. There would be no need for myofunctional therapy. And to kind of build on that question, some people can't even figure out how to put their tongue on the roof of their mouth. They're like, how do I even do that? It doesn't fit. It doesn't go. How do I even do that? So sometimes we have to do like proprioceptive activities and be in different activities with props and tools to even wake up the nerves enough to be able to get it to do that. So that's a hard question because you have to build up to it.
Yeah.
Yeah.
Sure. No, and that's fine. But all of a sudden I'm like, what about when you have a giant bite of food that you need to swallow? So that actually is helpful. And I really appreciated trying that. That was really fun. But let's just take a 10,000th view of all 4 of our episodes here. We've talked about a lot of common symptoms that adults and kids are experiencing that you never would have thought would relate to your mouth. So I hope that you guys have found this really insightful and you found actually hope here. But let's just talk about what this journey of starting myofunctional therapy looks like for kids and adults and what people could expect if they decided to step out on this journey. First of all, it would start with a free consult with you just to ask questions. Is that right?
Yeah, a free discovery call. Yeah, a consult would be when we do the full assessment. Yeah, so we would just have a conversation to start.
Sure. Yep. But then for kids, we kind of covered that a little bit in the kid episode. So let's just actually talk about adults first here. But what would this journey actually look like? Like number of appointments with you, expectation on appointments. Do they need to find an airway dentist? Other things like that.
For an adult, we're looking at about meeting every 2 weeks for 12 sessions over about a 6 or 7 month period of time. I want to have consistency because that's how you're going to meet your goals. With children, that might be broken up into longer time periods based on where they're at. So that one would be an individual, discussion based on kids. But generally, we're looking at 6 to 7 months, about 12 sessions. If we can't meet certain goals, then we might recommend the airway dentist referral. If you literally can't breathe through your nose, you might need to see an ENT before we can even start. Again, because if you can't breathe through your nose, nothing's going to work. And then if, we decide that you are a candidate for a tongue tie release, that posterior tongue tie release, that's going to then come down to between you and the doctor to make sure you're a good candidate for that. But then we also get you ready for the stretches to do that as well. And then there's aftercare. I keep in touch with you. We meet again in 3 months after you're done to make sure that you've habituated the swallow. End goal, ding, ding. And if you haven't, then we just do some touch up, exercises just to get you back on track. But by then, you're habituated. Most people are doing saliva swallows automatically within 2 or 3 visits.
Yeah.
So it's very achievable.
The real goal here is just to make good habits, right? And have good structure and function. Yeah.
And I can't believe that something so simple as doing some myofunctional therapy.
I mean, it takes work, but
yes, but I mean, it's simple in concept.
Yeah.
It doesn't have any needles involved. Like, I mean, if you have to get a tongue tie released or something, there's going to be some things that you may need on your own personal journey. But when we're talking specifically about myofunctional therapy, it's not very intimidating. It's just more of something that you just need to do for a period of time to have everlasting results and potentially your life changed health-wise. Like, that's incredible. And that's why we want more people to know about it. What are some additional ways that people can support themselves on this journey? You talk about nose breathing. So do you recommend like nasal sprays, or is there anything you can focus on when you are eating to help make sure that you're supporting all the exercises that you have been doing? What would you have to say about additional ways you can support your journey?
So nose clearing is huge. Nasal hygiene is something that also does not get a lot of attention. I am not endorsed by any product, but I do like something called Clear. It's XLEAR, so it's the word clear with an X. It's a saline spray with xylitol. And the xylitol is used to help prevent adhesion of bacteria into the mucous membranes of the nose. So it helps to shed off some of the bacteria and particles before it can embed in. It's great. Look into it. Just like they use a xylitol in dentistry for bacterial control in teeth, it really helps with the nasal cavity. Any kind of saline spray, a neti pot, a Neomed bottle, any of those things are good.
Is that something you would do daily or like only when you have congestion?
It depends. If you're very congested, I would probably recommend like a daily protocol twice a day. And then once you get past the congestion, then maybe it's maintenance a few times a week, but individual.
Okay. What about like chewing slower or anything else when it comes to meal times and actually using our mouths for everyday things?
Yeah, you always want to take a manageable size bite of food and chew it thoroughly. That's hard for us to do in our busy lives. But that is something we actually work on as we go through the program to integrate some of those habits as well. Keep an eye, though, on if people are chewing with their mouth open a lot, because I know I'm getting off your topic, but we see people chewing with their mouth open, whether you're at a restaurant or it's your kid. Oftentimes, these people can't breathe because your body can't breathe and chew and swallow all at the same time. So if you see that person, taking big sloppy bites and they kind of look like a slob, I promise you they are not being rude. They're not being disrespectful. They probably can't breathe. So if they can breathe better through their nose, their chewing and swallowing is going to get better too.
I'm trying to think of the people in my life right now.
And now you'll see them everywhere. Every time
right.
you go.
It's like when you buy a car, all of a sudden you see that car everywhere, right?
Sorry, guys.
What about gum? Are you a fan of gum chewing? Is that helpful?
Yes and no. Again, there's a place and time. We don't want to overdo it. I'm a big gum chewer myself. You want to keep it moving from side to side.
Oh, sure.
And same thing with chewing. You want to try to have bilateral chewing, or where you're moving the food side to side, because that's going to create muscle strength equally on both sides and also support the jaw joint on both sides so you don't wear down one side of your mouth. We all tend to chew on one side more dominantly than the other.
Yeah.
So if you're moving it around, sure, it's fine.
Okay.
Yeah.
Yeah, that's good.
Man, we have covered so much in these 4 episodes. Is there anything else that we haven't talked about that you feel like you want people to know about myofunctional therapy?
If I keep talking, I won't stop. So.
Well, you had mentioned too, like having just a team, right? It's not just myofunctional therapy that's going to fix the problem, right? It's having a team of people.
Yeah. And it's never, no matter what your field is, what your modality is, there is no profession that's going to fix or cure everything. So sometimes we might have to work with another provider. Maybe you need a chiropractor, or you do need an ENT or an airway dentist, and we'll have those conversations as they need to happen. But sometimes that's overwhelming to people, and that's not the goal. We just want to give you the education and the knowledge so you can get the best well-rounded healthcare and make informed decisions for your overall success.
Yeah, absolutely.
Awesome. Well, thank you so much for joining us and sharing your knowledge with us, Becca. We have learned so much, and we're excited to help Northeast Wisconsin learn more about myofunctional therapy and how it can really benefit them.
Thank you so much for having me. It was great.
This is awesome. Thank you.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver. And our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.